The federal opposition leader, Tony Abbott, wasn't the only heavy hitter visiting Hobart today. The Health Minister was also in town, talking up the benefits of the Gillard government's health reforms.
As Tony Abbott toured a clothing manufacturer, the Federal Health Minister was across town inspecting progress on a GP super clinic. Nicola Roxon was all smiles, despite the Clarence project being behind schedule.
We were hoping it would be open by January this year, and we're now looking at an April-May start date.
Ms Roxon was in Hobart to spruik the federal government's new health deal with states and territories.
We will now be investing nearly $1 billion into the Tasmanian community for better health services for patients.
But the agreement will require public hospitals to meet benchmarks, such as reduced waiting lists for surgery.
These targets that are set are nationally ambitious. They will be difficult for each and every state to achieve.
It's a challenge the Premier's taking in her stride. Lara Giddings today launched a 10-year plan to improve the health of Tasmanians through regular exercise.
We need to put a lot more effort into preventative health as well to relieve pressure off our hospitals in the future.
Those hospitals could already be under pressure if the government axes public sector jobs to solve its budget woes. But the Premier has vowed to be open with unions.
I'm quite happy to provide as much information as they require to understand the problem that we've got and the need for action now.
The opposition's concerned completion of the $42 million Kingston bypass south of Hobart could be in jeopardy due to a significant lack of funding.
The Minister needs to explain how he is going to manage that funding shortfall. Are they going to cut programs, or is this project going to be delayed?
That's a critical piece of infrastructure for that growing municipality, and it will be done.
The government says the bypass is expected to be completed later this year. Brad Markham, ABC News.